Hi, my name is Linda, and I am a nursing student at UCI presenting for the IHSS Caregiver Education Project on how to prevent and treat urinary tract infections. Here with me today to present on this topic are my fellow classmates.
Hello, my name is Heidi. I am also a nursing student.
Hi, my name is Simran, and I'm also a nursing student.
And my name is Lacey, and I'm also a nursing student.
Hi, my name is May. I'm a nursing student as well.
We want to begin by acknowledging our professor, Dr. Jung-Ah Lee, and we want to thank her for her guidance throughout this project. She's one of the associate professors at UCI School of Nursing, and we would also like to thank the Geriatric Workforce Enhancement Program, UCI Department of Family Medicine, Division of Geriatric Medicine and Gerontology. And as a disclaimer, this information or content and conclusions are those of the author and should not be construed as the official position or policy of, nor should any endorsements be inferred by HRSA, HHS, or the US government.
To begin with, for our outline, we're going to overview urinary tract infections, so UTIs. We're going to go over what are urinary tract infections, the risk and causes, symptoms, what to do if you, the caregiver, suspect they have a UTI, when UTIs become a medical emergency, and the gender differences between UTIs. We're going to continue by talking about the prevention, which includes hygiene, catheterization, safe sex, physical exercise, hydration, which includes both water and cranberry juice, and then other tips for UTIs. We're also going to go over prevention tips from other caregivers and the treatment plans we have.
So to begin, we're just going to start off with an overview on what urinary tract infections are. So according to Mayo Clinic, a urinary tract infection, or UTI, is an infection that occurs in any part of the urinary system. The urinary system includes the kidneys, ureters, bladder, and urethra. Though it includes all of those areas, most infections involve the lower urinary tract, which it is the kidneys and the urethra. So there are different types of UTIs based on their location in the urinary system. When they occur in the bladder, it's referred to as cystitis. Urethritis is the infection of the urethra. You can also have ureter infection, and one of the most serious types of UTIs is called pyelonephritis, which is an infection in the kidneys. UTIs can also be acute or chronic. A chronic UTI is defined as having 2 or more UTIs in 6 months, or more than 3 UTIs in a single year.
Some risk factors for UTIs in older adults is having a history of UTIs, poor hygiene, such as wiping from back to front, or having too tight clothing, or adult diapers that are too tight. Age plays a role in terms of as we get older, our immune systems tend to get weaker and our muscles get weaker, such as our pelvic floor wall. And then also we may have catheterization. Comorbidities also plays a role, such as diabetes, but also hydration. So being dehydrated can play a role. So if you look at the image located in this picture, you'll see where urine color should be having about a pale to transparent yellow is the goal. Anything darker, we start to acknowledge it may be dehydration or a UTI.
So for the possible causes of UTIs, they can be typically very common to get. Starts off by bacteria typically entering the urethra and travels to the bladder, which causes an infection. Then we also have sexual activity, which can cause UTIs because of the friction, which is involved in sexual activity that pushes bacteria towards the urethra. For yeast infections, they can cause UTIs because of the yeast population in the vagina growing to greater numbers than normal. This leads to an increase in yeast, which leads to inflammation of the urethra. And as a turn of results, the urination becomes very painful for people. Stress can also lead to high cortisol levels, which weaken your immune system. As a result, UTIs can become very common. It deals with the fight or flight response. And then lastly, any blockage in the urinary tract, for example, can cause UTIs. This can include kidney stones, bladder stones, or even a large prostate gland in men. These stones are typically a large and hard mass that is formed.
Some possible symptoms of UTIs is an increased urination that may be painful to your care recipient, and their urine may be an abnormal color. So we're looking at either cloudy or dark urine. There may even be blood in urine in some cases, and then you may notice a very strong odor that was before. Back pain, fatigue, poor motor skills, and dizziness may also be shown as signs of a UTI. In severe cases for older adults, altered mental status, such as confusion or delirium, may be seen.
So what to do if I suspect they have a UTI? The first step would be to schedule an appointment with their OBGYN or primary care physician. Next, if it is recommended, we would have them follow their prescribed medication and follow the regimen strictly. It is important to complete the full duration of the treatment and schedule a follow-up appointment if needed. Typically, you'll be given an appropriate antibiotic that will be dependent on the bacteria you may have. Drinking cranberry juice or cranberry extract may also help alleviate symptoms and prevent further complications. Lastly, it's very important to be patient with UTIs as they typically go away very easily with time.
So when a UTI becomes a medical emergency, this occurs when somebody experiences any new symptoms. So older adults actually experience different symptoms associated with a UTI than the younger population. So as mentioned before, older adults are susceptible to experiencing an altered mental status with confusion and delirium. So there are gender differences associated with urinary tract infections. Women get UTIs up to 30 times more often than men. And the reason why women are more susceptible to getting UTIs is because they have a shorter urethra than men. So with that shorter distance, the bacteria actually can easily travel to the bladder to cause the infection. In addition, older adult women experience the effects of menopause. So postmenopausal women have a decline in estrogen circulating in their urinary tract, which makes them more vulnerable to infections.
Next, we're going to be speaking a little bit about prevention, and this slide highlights all of the topics discussed, such as staying hydrated, showering, avoiding irritants, eating healthy, and the list goes on. So hygiene tips for elderly women. Of course, the main one is to wipe correctly. So if you are taking care of a patient who is wearing a diaper or who can't clean themselves, the correct way is to wipe from front to back, not back to front, because if you go back to front, you're going to accumulate all of the bacteria and push it forward to the vagina, which can ultimately cause a UTI infection. Be sure to change diapers, as this will also reduce the residue amount, which can accumulate and ultimately also cause a urinary tract infection. Keep the genital area clean, so no plaque accumulates as well. Cotton underwear is very helpful in reducing bacteria, and be sure to also change that frequently. Emptying the bladder frequently as well, just to reduce bacteria. Hygiene tips for elderly men is also to urinate when you have the urge to. For caregivers, be sure that the penis glands is clean. If the patient is not circumcised, be sure to pull the foreskin back and clean around the glands to decrease plaque accumulation. Usually, if a person gets a UTI, the gland's penis is surrounded by whitish, cheesy looking plaque. If you see this in your patient, please be sure to clean that up nicely. Also shower frequently to reduce this plaque, and change diapers at least twice a day for both elderly men and elderly women.
So we want to talk about at-home catheter care, as many older adults may or may not have a catheter in place. So one of the main points of concern is to wash hands thoroughly with soap and water before and after handling the catheter or the bag. Leg bags should typically be emptied about every 2 to 3 hours, while larger bags can be emptied every 8 hours. And it's really, really important that the bag is kept below the level of the patient's bladder. So next we have a video on at-home care for catheter cleaning for men.
Welcome to the catheter self-care teaching video. At the end of this video, you will learn how to keep your catheter clean, how to empty your catheter bags, how to clean your catheter bags, how to change your catheter bags, how to prevent a catheter-related infection. A urinary catheter, sometimes called the Foley catheter, is a thin tube that drains urine directly from your bladder into a collection bag. This catheter is held in place in your bladder by a small water-filled balloon, so it will not fall out. As part of your recovery from your surgery, you will need to go home with a catheter and will need to take care of it at home. Taking care of your catheter, keeping your catheter area clean. Wash your hands. Gently wash the skin around the catheter and the catheter tube with plain soap and water. Wash the tube in a downward motion. Instead of soap and water, you can also use baby wipes. If needed, pull the foreskin of your penis back to wash around where the catheter is coming out, and pull it back over the head of the penis when you're finished. Pat the area dry with a clean towel. Add a layer of polysporin to the tip of the penis where the catheter is coming out. Do this every time that you clean your catheter area. Clean your catheter at least 2 times a day, once in the morning and once at night. And of course, to finish, wash your hands. You will be going home with 2 types of collection bags, the day bag and the night bag. The day bag will let you move freely during the day. It can be worn under your clothes by strapping it to your leg. The second bag is the night bag, which should be used for when you are going to sleep, as it can hold more urine than the day bag. In addition to the catheter cleaning, you can shower with your catheter and the collection bags. If you are able to stand in the shower stall, shower with the day bag on. If you are unable to safely stand in the shower, use a bathroom chair with the night bag and let that bag either sit on the ground of the tub or hook the bag where it will stay below your hips. The bags are waterproof, so you do not have to worry about getting them wet. You can dry the bags with a towel when you are done, but be careful not to touch these areas. And remember that you cannot have a bath while you have your catheter. Emptying your catheter bags. You should empty the day bag when it is about 1/3 to 2/3 full, or if you feel that the bag feels too heavy on your leg. To empty your day bag, wash your hands. Place the blue end of the bag over the toilet and turn the valve to the left, counterclockwise, and drain the urine into the toilet. Do not touch the actual opening with your fingers. You can open and close the port by keeping your fingers on the valve. When the bag is completely empty, turn the valve to the right, clockwise, to close the valve. Finally, wash your hands. For your night bag, empty it in the morning when you wake up or when it looks full. To empty your night bag, wash your hands. Unhook the drainage valve from its clip at the bottom of the bag. Place the valve over the toilet and slide the valve to the left to open. Do not touch the opening with your fingers and just let the urine drain into the toilet. When the bag is empty, slide the valve over to the right to close. Wash your hands. If you forget which direction it is to open or close the valve, this is also written on the bag. How to clean your catheter bags. Pour a teaspoon of vinegar or 1 pump of unscented liquid soap into the bag from where the bag will connect to your catheter. Run the bag over a small stream of water and fill it to about 1/3 full. Then swish the bag around. Then you can empty it through the valve. Changing between the day and night bags. To change between the bags, you need to know how your catheter is connected to the collection bags. The catheter itself is just a tube that comes out of your body. Everything else is the collection bag. To change the bags, wash your hands. Empty and close the bag. Wash your hands again. Put a towel in between the bag and your leg. You can also do this in the washroom. Use 2 fingers to pinch your catheter tube closed so that the urine doesn't leak during the bag change. Keep it pinched until you are done changing the bags. To take the bag off of your catheter, gently roll the catheter tube away from the bag. Do not pull on the catheter or the bags. Gently rolling on the catheter will help you get the bag off. Take the bag that you wish to put on. Take the blue cap off of the end so that you see the clear part of it. Connect the bag to your catheter. Do not throw the blue cap away. Keep the blue cap to cap off the bag that you will not be using. You may now unpinch the catheter and let the urine continue to drain out into the collection bag. Wash your hands again. The steps are the same when changing the day bag to the night bag or changing the night bag to the day bag. You can leave these bags in the washroom with the blue cap attached to the tip. Try to leave them where the opening of the bag is not touching anything. How to prevent a catheter-related infection. To prevent a catheter-related infection, there are 7 key steps that you will need to follow. Number 1, always wash your hands. Wash your hands before you touch the catheter and wash your hands after you touch the catheter. Number 2, drink water if it's right for you. If you can, drink at least 1 liter a day or 4 cups of water. This will help you keep hydrated and help flush out any remaining blood clots from your surgery. Number 3, clean your catheter at least 2 times a day, once in the morning and once at night. If the catheter or the area around it becomes soiled, clean the catheter area again. Number 4, use a night bag when you're going to sleep. The night bag holds more urine than the day bag, so you won't have to empty it during the night. Number 5, to prevent infection, do not let any urine drain back into your bladder. Always keep the bags below the level of your hips. This will allow the urine to drain away from you. If you are going to lie flat, use the night bag and keep it below your hips. Number 6, do not let the catheter tug on you. The catheter should always hang loose so that it doesn't pull on you when you're resting or moving. Number 7, read the information sheets that will be given to you by your nurses. The information may help you understand more about your catheter. Having a catheter is part of your care and recovery after surgery. Your healthcare team is here to support you. So if you have any questions or concerns, ask your doctor or your nurse. Welcome to the catheter self.
Now we will be talking about safe sex and how that plays a role in preventing UTIs as well for both men and women. So for first, men, obviously condom use will be very helpful in not only reducing STIs, but also UTIs, only because when there's penetration happening, it's very easy for bacteria to both flow into the urethra of men and women. So having a condom as a barrier will reduce this. Using lubricant will also be useful because women usually get menopause by the age of 51. And from there, the ovaries stop producing the female hormone estrogen. So the levels begin to decrease. And one of the early signs of reduced estrogen is having no wetness in the vagina. So using lubricant will reduce that friction during penetration, which will also help in reducing bacteria accumulating and causing both UTI in men and women. Drinking water after intercourse is also helpful because it will help patients urinate, which will flush out all of the bacteria. So that's the same for men and women. And for women, it is also recommended that they urinate after intercourse, only because of the bacteria accumulation. So once we urinate, it will cleanse out that bacteria, or we hope that it will cleanse out that bacteria.
Physical exercise is also encouraged to help prevent UTIs in older adults. Physical exercise improves mobility, cognition, and the strength of the pelvic floor muscles, as well as other muscles, as well as increasing thirst, which will help with flushing out potential bacteria from building up. So increasing urination will help with preventing of UTIs. The CDC recommends that if you're 65 or older without a limiting condition, for you to exercise 150 minutes a week during an aerobic exercise, which is basically cardio, and then 2 days a week at least towards muscle strengthening. So that's body weight workouts. Some examples of physical exercise is brisk walking. So this can be done as a family event if needed, such as like morning or evening walks, but it can be a social event done with family and friends. Swimming, this is typically a group activity also. And if you wanted to make it a fun group activity that's guiding, doing water aerobics is encouraged. And then dancing, so Zumba Gold is highly encouraged and also within limitations, takes into account age. Some body workouts you can do at home are knee extensions or overhead press, just different things you can work with a chair that still helps with the pelvic floor, which will help with urination and also just overall health. Some other tips to prevent UTIs, as Heidi was mentioning, encouraging urinating at least once it occurs is the best, because we do not want the urine to just sit there and allow that bacteria to build up. But also checking adult diapers every 2 hours, just in case there is incontinence, which just mainly points to there may be weakened pelvic floor muscles. So there's a little bit less control over when they do urinate. Avoiding caffeine and alcohol. So really monitoring the care receiver's diet can play a role. And then avoiding fragranced soaps and other irritants to the vagina for those who are women, older adults.
Okay, so treatment for UTI, to provide highest quality of medical management for patients with UTI, it is best to provide care in a multidisciplinary way that involve both physician and nurses. Once UTI has been diagnosed, it is very important to educate the patients to drink more fluid. For women with recurring UTI, it is beneficial to take prophylactic antibiotics to prevent future UTI from occurring. For patients who are undergoing UTI, they should take the antibiotics or antimicrobials that physician has prescribed. There is also a very well-known non-medical remedy that caregivers can educate patients with, which is to drink cranberry juice. Additionally, as my classmate Heidi has talked about, sexually active women need to avoid right after sexual activities because urination helps flushing the bacteria out of the bladder. As mentioned in the previous slide, education patients to increase water intake is essential in treating UTI because fluids adds volume to the urine and promotes urinations, which helps diluting and flushing out the UTI causing bacteria, which reduce the risk of developing further infection. It is recommended to drink 6 to 8 glasses each day to flush the bacteria out of the urinary system. Besides drinking more water, patients with UTI can also try cranberry juice to treat UTI. Researchers have suggested that there's an active compound in cranberry juice that are not digested in the GI system. Instead, this active compound works to fight against bacteria, including E. coli. It helps preventing UTI causing bacteria from sticking to the urinary tract lining, therefore promoting flushing of the bacteria during urination. Cranberry also limits the bacteria's ability to grow and proliferate, so it is a great home remedy treatment for UTI. One tip is that it is better to drink pure unsweetened cranberry juice rather than cranberry cocktail. Recommended amount is 240 to 300 milligrams per day.
Some prevention tips from other caregivers is having a portable bidet just to help with cleaning if cranberry juice is not liked, like you do not like the flavor. Having high potency cranberry pills, adding ice to fruit smoothies just to increase hydration and water intake, and then counting to 30. So after your care recipient urinates, counting to 30 just allows time just to see if there's potential more urination, if there is weakened pelvic floor muscles that may like cause leaking later on, and that will help just get that extra leakage out. Some resources for Caregivers is a YouTube channel called Family Caregiver Alliance. And we do not have to watch this video, but it is about toileting and incontinence cleaning tips for older adults. The link is below, and it's highly encouraged to just check out their channel. Additional resources are some websites, Aging Care. They have home care remedies that can be just done at home from other caregivers, as shown in this slide. Just some UTI signs, symptoms, and treatment ideas. And then, as well as the Center for Disease Control and Prevention, the CDC, they have more input on urinary tract infections, physical exercise recommendations for older adults, as well as catheter-associated urinary tract infection care and what it is. And here are some additional articles just to read, again, if you wanted to learn more about UTIs with older adults. Thank you so much for your time. And if you have any questions, please email Jung-Ah at jungahl@uci.edu. Thank you so much for your time. Bye-bye.